Today, we're going to talk about a condition called NASH. NASH just stands for non-alcoholic steatohepatitis. It sounds big, but here's the simple version. Steatio just means fat. Hepatitis means inflammation of your liver. So NASH means you've gotten extra fat in your liver and the liver is inflamed because of it. It's not caused by heavy alcohol use. It happens in people who drink little or no alcohol. When the liver is both fatty and inflamed, it can't keep doing its job properly. Over time, this can lead to scar tissue, loss of function, or even liver failure. Many people with NASH, they don't feel anything. It's often silent because there are no strong symptoms early on. The damage can build up before you even realize it. NASH is linked to major global issues: obesity, diabetes, high cholesterol, and metabolic syndrome. If left unchecked, NASH can progress to scarring of the liver, called fibrosis or cirrhosis, liver failure, and even liver cancer. So knowing about NASH is not just nice to know, it's critical. Knowledge gives you a chance to act early on and protect your health. Think of your liver like a sponge or a filter. When fat builds up and your body becomes less able to manage sugar and fat, the liver gets overwhelmed. That overload leads to inflammation. Some of the key causes and risk factors is, again, being overweight, also called obesity, having type 2 diabetes, and even insulin resistance, high cholesterol or high triglycerides, high blood pressure, and metabolic syndrome, a sedentary lifestyle and a poor diet, lots of processed foods, little Debbie cakes, potato chips, high in sugar, and also low in activity. The good news, because these are lifestyle linked, many of them are within your power to change. Since NASH is often silent, you may not notice anything wrong until it's progressed a lot. But here are signs to watch out for: feeling unusually weak or tired, pain or discomfort in the upper right part of your belly, just under your ribs where your liver sits, elevated liver enzymes found in routine blood tests, even when you feel just fine. Later, if damage is worse, swelling, fluid in your belly, yellowing of the skin and eyes, which is also called jaundice, and or confusion. Because early signs are vague, screening and checkup, they matter a lot. Now let's talk about some things that can help slow the process of NASH or how to prevent it. Lose any excessive weight. Even a modest weight loss, like 5 or 10% of what you currently weigh, can improve liver fat and inflammation. Eat a healthy diet. Lots of vegetables, lean protein, whole grains, lower sugar. Limit processed foods and saturated fats. Exercise on a regular basis, at least 3 to 5 times a week. Aim for 30 minutes of moderate activity most days. So if you walk, make sure you're walking up a sweat. Control your diabetes, your cholesterol, your triglycerides, and your blood pressure. The more these are managed, the less strain on the liver. Avoid excessive alcohol or discontinue all alcohol products immediately. And also, keep up with your regular checkups. Ask your healthcare provider about liver tests if you are at risk. While there wasn't a widely approved medication for NASH for many years, newer treatments are emerging. One example is a drug approved in 2024 for adults with moderate to advanced fibrosis due to NASH. But even with those treatments, lifestyle remains the foundation. Do you not know that your bodies are the temple of the Holy Spirit? Therefore, honor God with your bodies, your health. Your body is sacred. Protecting your liver, making wise choices, and stepping into health is an act of worship, not just self-help. Now that you know what NASH is or have a basic understanding and how much power you have to prevent it or slow it down, let's act. What's one small change you'll make this week to support your liver health? Are you due for a checkup or a liver screen? Maybe you'll share this message with someone you love who is at risk, someone who has obesity, diabetes, and even high cholesterol. Drop a comment below. What steps are you taking this week? What other health topics would you like us to explore on our next video? Let's walk this journey of health together. Knowledge turned into action, faith turned into habits, and health turned into wholeness. Until the next video.